Hello, my name is Lars Søndergaard. I'm a professor in cardiology based in Copenhagen, Denmark. The Portico NG study is evaluating the safety of the next generation Portico valve, the Navitor valve, to evaluate the safety and the performance of this valve in patients with severe aortic stenosis and high surgical risk. The Portico valve is a self-expanding technology with interannular leaflet position. So the iteration from the Portico to the Navitor valve is, first of all, there's an outer active sealing cuff in order to mitigate the degree of paravalvular leak. And also the radial force has been optimized across all valve sizes. It currently comes in 23, 25, 27, and 29 millimeter. But there will also be a fifth valve, the Navitor Titan valve, which is going all the way up to an annular size of 30 millimeter. And finally, there will be a more curved outflow portion of the stent frame. The Portico NG study included patients from Europe, Australia, and the US, and it's going to be used for hopefully to gain both FDA and CE mark approval. The patient who's going to be enrolled are patients at high surgical risk with severe aortic stenosis. The results which was presented at EuroPCR 2021 was the first 120 patients enrolled, and this was actually used to now gain CE mark approval. There will also be, as I said, more patients included from the US, and hopefully soon the application for FDA approval will be sent. So for the first 120 patients, we know that these patients were at high surgical risk, both based on age, STS score, and frailty score. And very important, the results show that this was a very effective treatment. Patient had a very low transvalvular gradient, 1 digit, and a very large opening area, 2.0 square centimeter. And very importantly, this outer active sealing cuff did really mitigate the degree of paravalvular leak. So 80% of the patients have none or only a trace of paravalvular leak, and the remaining 20% of the patients had only a mild paravalvular leak. So none of the patients had moderate or severe paravalvular leak. And also importantly, it was a very safe valve to use. So the primary endpoint was 30 days mortality at, and this was 0%. So I think what we can conclude for this first 100 patients enrolled in the Portico NG trial with the Navitor valve is that it is very safe. As I said, none of the patients died within 30 days, and it was very efficient, both offering a very large opening area and a very low transvalvular mean gradient, and very importantly, none of the patients had more than a mild paravalvular leak. So I think this is a valve which is very suitable for moving forward with TAVI, both in the current patient cohort we're treating, but also potentially for the future expansion into patients at a lower surgical risk. One of the potential concerns about adding an outer sealing cuff is that it's going to increase the rate of conduction abnormality. But we actually saw in this study that it was unchanged, maybe even less than it was with the Portico first generation valve. So for patient at risk, 15% of the patient had a new permanent pacemaker, and almost all of these patients had pre-existing conduction abnormality. So I think we can conclude that adding an outer active sealing cuff did not increase the risk of new onset conduction abnormality. So my take-home message from this study is that the Navitor valve is a providing an excellent hemodynamics with large opening area, low gradient, and a very low rate of paravalvular leak, with 80% of the patient having none or only a trace paravalvular leak, and the remaining 20% of the patient only a mild paravalvular leak. So once again, this is a valve which will certainly meet the expectation when TAVR is going to move forward to patients with longer life expectancy. The Portico NG study enrolled patients at high surgical risk. And we will now see that the Advantage study is going to be launched, enrolling patients at intermediate and low surgical risk, which is going to be very exciting.